Well, the main reason doctors get excited about high blood pressure or hypertension is its long-term effects on the body. So hypertension is a silent condition. You wouldn't know what your blood pressure is. So most patients turn up, for example, at their GP or at a routine medical, get their blood pressure measured and find that it's high. And they, in the vast majority of patients, have no symptoms or problems that can be immediately attributed to the high blood pressure. In other words, the high blood pressure doesn't, in the short term, cause them any problems. The main impact on your health in the longer term is the effect on the circulatory system. So heart and cerebral brain circulation are affected by high blood pressure. So the main long-term risks from high blood pressure are an increased risk of heart attack and an increased risk of stroke. And we know that reduction of high blood pressure considerably reduces those risks in the long term. So if you're seeing someone about your high blood pressure, that doctor is looking at how you will be in 5, 10, 20, 30, or even more years. The lifestyle changes are what you might expect to help lower blood pressure. Most people will be aware that we're all supposed to be cutting down on our salt intake. In the UK, we're supposed to be eating less than 6 grams a day, which is still a vast amount more than our ancestors ate. So one lifestyle modification is cutting out salt, and most of the salt we get in this country comes in processed foods from the supermarket. Only about a quarter of the salt is what we sprinkle on our food with our meals. Obviously, one important lifestyle modification is to stop adding salt to food, and I can talk to patients about that. The other major lifestyle modification is weight loss, and most people viewing this video will be aware that there's an obesity crisis where a very substantial proportion of the population is overweight, and weight gain pushes up your blood pressure. And it's typically, in my patients, it's weight gain in adult life. So another lifestyle modification is to help lose weight by calorie reduction and increasing exercise. So further obvious lifestyle modifications would include increasing your exercise, certainly to the standard amount of exercise recommended, for instance, by the UK Chief Medical Officer, which is 2.5 hours a week, for example, half an hour of exercise 5 days a week. So losing weight, increasing exercise, cutting out salt, and also there are changes to your diet apart from cutting out salt that are important to reducing blood pressure. In general, in all patients with high blood pressure, you can think of the high blood pressure as overworking the heart. So in particular, the left side of the heart, which is responsible for pumping blood into the arteries, becomes, if you like, stressed and overworked, and gets larger over time. So the long-term complications in all patients with hypertension include ultimately heart failure. They include heart attack, and the blood vessels in the brain, both small blood vessels and larger blood vessels, are affected by the high blood pressure over time, causing either mini strokes, also called a transient ischemic attack, or TIA, small strokes, which have an accumulative effect on the brain over time, or larger strokes, including both brain hemorrhage and cerebral infarction. And then in kidney patients, they have a magnified risk of all these problems that I've talked about with their high blood pressure. But also the high blood pressure can cause a vicious circle. So the high blood pressure causes kidney damage, causes worsening high blood pressure. They can develop a vicious circle in which their kidney disease and their high blood pressure gets worse. Early intervention is obviously first and foremost blood pressure control, getting your blood pressure down to a good level based on typically home readings using a standard device, blood pressure monitor at home. But intervention in kidney patients can also consist of specific use of drugs, both to lower the blood pressure and help the kidneys, typically by lowering the protein leak in the urine, or what doctors call proteinuria. So all the interventions, both in patients in general and in kidney patients, are focused around getting the blood pressure down, with the addition in kidney patients of reducing signs of specific problems within the kidneys. Okay, well, obviously developments in hypertension, it's an extremely common problem, one of the most common conditions across the planet, and responsible for the highest level of morbidity, in other words, disease and damage to patients and mortality across the planet. So it's an ever-changing field, but there are new drugs being developed all the time. And I would also note for some patients who either have very resistant hypertension or can't tolerate drugs, in the UK, the National Institute for Healthcare Excellence, or NICE, has recently given preliminary approval to a technology called renal denervation. In certain patients with high blood pressure that is very difficult to treat, you can put a catheter into the renal artery and heat the renal artery in such a way that the nerves outside that artery are burnt. And that then means, through a complicated series of effects, that the blood pressure is reduced to a moderate extent, not to a huge extent, which allows better control of blood pressure and potentially less use of medication in certain patients. So there are both drug developments, in other words, pill developments, and device developments in high blood pressure ongoing at the moment in 2023.